Good. Ladies and gentlemen, we are here as the Senate Health Committee to inspect Longisa Level 4, was supposed to be operating as Level 5 facility here in Bomet. And as a Senate Health Committee, together with the County Assembly Health Committee of Bomet, we have had a joint inspection of this facility just to look at the services, how they are being offered, but also to look at and discuss with management of our facilities on the challenges they are facing. First, we want to take this opportunity to thank the county government of Bomet for the work they have done in this facility. We've seen clinical services are fairly very good. And one of the things we have noted, of course, is staffing, particularly doctors, medical officers, consultants, and the other cadres. And I think as the chair of the health committee, one of the things that has impressed is the issue of staff development. And the kind of staff development we have seen here seems to be well coordinated, in that when doctors are going for their specialization, the other cadres are also being given opportunity to specialize in specific sectors, and that means whenever they come back, the services of this facility will be lifted. We have also noted a few challenges. One is in the issue of space. This facility is seeing a very huge population, and the space and the facility is not sufficient. We've seen in the wards that are supposed to ordinarily have a capacity of about 64 patients, having patients close to 100, 90, 100 and something, and therefore there is need to expand this facility. We have also seen the issues of drugs and non-pharmaceutical management, and I think we have noted an issue of concern here that there is need for proper maintenance of records for purposes of tracking and even for purpose of ensuring logistically in terms of procuring, there is data available that can be used for that decision making. We have also seen a challenge of sewerage management here in Longisa facility, and the management has explained that there is land that was set aside for that function. Unfortunately, the land is in occupation by private citizen, a matter that we are informed is being addressed, but we are going to confirm with the county assembly members and the governor whether there's progress on that matter, so that the issue can be resolved. I think overall we want to say that this facility, there is good level of service. One of the other areas that has seen significant improvement is on the renal area, and the county government of Bomet has added additional 8 renal machines to support patients. However, that is still not sufficient. The number seems to be still a little bit high, and they are being forced to refer some of the patients. So, but I think there is improvement in that expansion, but there is need to make sure there is accommodate. I think the biggest challenge in that department is they are yet to get a nephrologist to be able to support the trained clinical officers and the nurses and the medical officers who are there, but they are doing a good job. And I think finally I want to say the other challenge that we have observed is on the issue of the contract of the managed equipment, which expired, and I think it needs policy direction from Minister of Health. That is a matter that as a Senate Health Committee we are going to take up the matter with the ministry to ensure there is seamless transition at the expiry of that contract and counties taking charge of that process. So I don't want to say more than that, but if my colleagues have something, we can allow them. Maybe Senator Sigei, you can say something.
Committee of the Senate for creating time to visit Longisa Hospital today and the County of Bomet. Secondly, I want to also appreciate the work that you have done, because whatever we have done today, the comments that the chairman have said you must have heard, are all geared towards improving service delivery to the people of Bomet. The challenges which we have picked, of course, are largely within the area of record keeping, the procurement area, and the drugs, both at the laboratory and in the procurement section, which I believe out of today's visit, that particular area will be relooked at for purposes of ensuring that whatever we order, whatever we receive, and whatever we will pay for, because this is money from the taxpayer, are put into good use, and we also supply the drugs which are going to help our people. I believe this visit, Chair, will also facilitate the county government in terms of running its administration to ensure that that record keeping, which is one of the major things which I think we picked from this visit, will improve. In terms of the improvement of capacity building in doctors, you have responded very well. I would also wish to encourage the administration to make sure that they do not release as much as possible so that they lack capacity whenever their doctors, nurses, clinical officers are out in capacity building. And lastly, the major issue is the challenges with which we've received in terms of space. There is a lack of space both from the lab, from the stores, from the areas which we've all gone. They have a challenge with regard to space. That is an improvement that we must work towards achieving an improvement to get the service to the people. Otherwise, I want to encourage you to also continue doing this particular visit so that we keep the oversight role and also the obligation of the health committee within the national government, yes, and the county government, and do the collaboration with the health committee in the assembly to support service delivery to the people. Thank you.
Hospitalini na tulipoenda katika maternity tumeona ndio kuna pungufu chache, hasa kama kina mama ambao wamejifungua wanatumia kitanda kimoja, akina mama wawili pengine watatu. Hiyo ni changamoto ambayo tungependa kuwa iangaliwe, kwa sababu watoto ambao wanazaliwa ni viongozi wa sasa na kesho ambayo inakuja. Lakini kwa ujumla naona wamejizatiti kabisa kuwapa akina mama ambao wanajifungua afya ya mbele, na hasa wale watoto ambao wanazaliwa kabla siku zao za kuzaliwa hazijafika. Tumeona pia sehemu hiyo, hospitali hii imetia bidii na ningependa kuwapa pongezi, lakini kuwasihi mambo ya akina mama ambao wamejifungua kulala kwenye kitanda kimoja akina mama wawili, tuangalie katika sehemu hiyo. Asante.